Hello friends, Namaste. In this video, I am going to discuss about the discharge in chronic otitis media mucosal disease and chronic otitis media squamous disease or CSOM eticanthal disease. The discharge in CSOM TT or tubotympanic disease or chronic otitis media mucosal disease is typically intermittent in nature. It happens once or twice a month, maybe once or twice a year also. Whereas the discharge in chronic otitis media squamous disease is continuous because of persistent low-grade infection. The discharge in chronic otitis media mucosal disease is copious in amount because of presence of goblet cells in the station tube area as well as in the medullary cavity, which secrete mucin and which secrete plenty of secretions. And the epithelium there is respiratory epithelium which secretes lots of secretions. The discharge in chronic otitis media squamous disease is scanty because of persisting low-grade infection and absence of goblet cells in the eticoenteral area. As we go from middle layer to the mastoid, the mucosa changes its pattern. It becomes cuboid and does not contain any secretory cells in the mastoid area. Therefore, the discharge is scanty in amount. The discharge in CSM TT is whitish to yellowish in color due to presence of mucin and pus, whereas in CSM eticanthal type, the discharge is truly purulent. There is no mucin. The discharge in CSM TT is sticky in consistency, whereas in CSM eticanthal type, the discharge is not sticky, absence of mucus. The discharge in CSM TT is non-foul smelling, although occasionally it becomes smelly, but most of the times it is non-foul smelling. But the discharge in CSM eticanthal type is usually foul smelling because of presence of anaerobic infections and bony sequestra. There is lots of anaerobic infection in chronic otitis media squamous disease. The discharge in CSM TT is usually not blood stained, but in case of CSM eticanthal type, the discharge may be blood stained because of presence of granulation tissues. Sometimes in CSM TT also, the discharge may be blood stained because of presence of polyps. Sometimes the polyp might arise from the perforation of tympanic membrane. The medial mucosa may be polypoid and come out through the tympanic membrane perforation, but it's more usual in case of CSM eticanthal type. To have persistent low-grade infection, our body tries to get rid of the infection, our body tries to fight with the infection. So there will be presence of granulation tissues, there is cholecystioma. When there are granulation tissue, while cleaning, it may be blood stained. When the patient has CSM TT or mucosal disease, it is very important to ask about duration of discharge per episode, maybe 4 days, 5 days, 6 days, and last year discharge, because the last year discharge determines the stage of disease, maybe active, quiescent, inactive, or sometimes healed. Thank you for watching this video. You can subscribe my channel Dr. Krishna Koirala for more videos like this. Thank you. Thank you very much.